Assalamu alaikum everyone. I hope you all are doing great. You are all welcome to the stream, and I would like to talk about asthma today because it is pretty common. About 10% of Pakistani population is suffering from asthma, which is one in every 10 person. In early years, it is more common in male gender, while in adults it is more common in female population. Not many people are aware of this condition despite of it being very common. And if you guys know anything about asthma, you can join the chat and I would love to answer your queries. What do people think? Is asthma a kind of allergy of the airways? Is asthma the allergy of the lungs? So, one answer right now who is saying no, it is not. So, what it is then? What you think? What you people think? Is asthma really the allergy of the airways? There are few of the symptoms which are quite common experienced by the patients are dyspnea, which is shortness of breath. The other common symptom is cough, which occur in bouts, and most of the time it occurs at the night or in the morning. And these patients can also have sleep disturbance. Their symptoms are kind of progressive and they are variable throughout the day. Their symptoms depends upon the weather as well. It can exacerbate in cold weather. It can also be exacerbated by exercise, by temperature change, by pollen, by smoke, dust, dander, and pets as well. Because some of the people are allergic to few of the things which I just mentioned. And there is a skin condition called eczema. There is quite high incidence of asthma in those who have other kind of allergies. If they have a nasal involvement, the allergies of the upper airway called allergic rhinitis, they are more likely to have asthma if they have the symptoms. This is quite common condition and can be managed easily with inhalers and with the avoidance of allergens. The inhaler which we mostly use are a mixture of steroids and sympathetomimetics. Some of the examples are Combivir, Foster, Solmicort. We can also use anti-allergic drugs because most of the people have post-nasal drip. We can also use Ryzik because GERD, which is gastroesophageal reflux disease in obese patients mostly, that GERD can also exacerbate the asthma. So we need to control that GERD also. If anyone is obese, obesity itself is an independent risk factor for asthma. So just controlling the obesity may lead to the improvement in asthma symptoms. In the start of the disease course, it is reversible in nature. With adequate medications, we can control the progress of the disease. But at later stages of the disease, it can become irreversible. So, the hallmark of asthma, which differentiates it from COPD, is its reversibility. With bronchodilator, the narrowing of the airways can be reversed. So we basically use three kind of drugs. We start with the inhalers, which contain a steroid, a sympathetomimetic drug, which are salbutamol, formoterol, albuterol, and anti-parasympathetomimetic, and the example is ipratropium bromide. So what these medications do? The role of steroids is in decreasing the inflammation, and the role of other two is to dilate the airways. So what happens in asthma is the narrowing of the airways because of the hyperresponsiveness, and in response to the inflammation, there is excessive mucus production by the goblet cells of the airways. There is muscular hypertrophy. And there are few people who are pretty popular who are suffering from asthma are Usain Bolt, who is the fastest man on earth, is also asthmatic. David Beckham, who is the most popular footballer, is also asthmatic. So, if not adequately controlled, it can cause devastating symptoms. It can be life threatening if not adequately controlled, but it responds so it has a great response to medications, and we need a step up or step down therapy depending upon the symptoms of the patient.